Good morning, everyone. How are you all doing this wonderful Tuesday? I am just getting on here to give you an update post chemotherapy. So, I had my CAT scan of the abdominal and pelvis area yesterday morning, and also I had my full body bone scan. So I'm praying that there is no sign of cancer in any of those areas that were scanned and seen yesterday. I don't have those results as of yesterday, but I am pretty sure that my doctors have that information and they're reviewing it and they'll post it to my chart. And once available, I will give you all an update because I do share everything about my personal well-being and health. And I love to spread awareness, being a healthcare employee and educator. It's very important to share information with everyone so they can stay abroad on their health conditions. If they don't have them, you will know what to do. But anyway, I am going to have my port removed tomorrow morning, God willing, and says the same. I am so ready because I'm tired of laying on my back. When I try laying on my side, because my port is on my right side, it gets kind of discomforting where I just can't relax like I would like to. But it doesn't hurt or anything. It's just like a discomfort knowing that something's right there. So I am so glad to finally get that taken out. I had it put in back in October. No, actually in September of last year because I started chemo in October. So it was in September. September 9th would be the actual day that I had it done. And I did share that information as well. But other than that, to let you know what's going on with me as far as side effects from chemotherapy since my last treatment on February 12th, I have been having lots of joint pain, but not bad. It's just sometimes it feels like my left leg wants to give out on me. It's so much on my upper thigh area. And the other thing, I've been having some, like, I've been feeling cold. So I don't know if it's my blood count or if it's because of possible infection because of the toenail removal. So my podiatrist who removed my toenail, she did give me antibiotic to take when she removed the toenail, and I refused to take it because I didn't want to take so many different medications. So I went ahead and I started taking that because sometimes I feel cold and my body is aching. So that is a sign of an infection. I don't have any other symptoms going on as far as maybe an infection, but that's what I'm assuming it is. So I started taking the antibiotic. And other than that, my fingers are still tingling and numb sometimes. And it's not bad like it was, it's a whole lot better. But the other thing, I was told by the nurse on oncology that these side effects from chemoneuropathy can last 2 to 4 months after final treatment. So I have been using turmeric, ginger in my smoothies and making my teas with the soursop. And for those of you who live in the Houston area, if you like soursop, Mi Tienda sometimes has fresh soursop. That's where I've gotten mine. And you can also order on Amazon. A lot of these places online will allow you to order them. If you are not able to locate some fresh soursop, you can probably try dealing with your local produce. Um, Other than that, some of my hair has grown back. It's like peach fuzz on the back of my head. So, um, and some of it's coming in gray because, I'm a cougar, 48-year-old cougar. But, and my eyebrows still really haven't growing back. So just a little peach fuzz. So I draw those in periodically. And what else can I tell you? But yeah, so it's been really hard for me to um, bathe. I notice, like when it comes to washing the back of my body, like my upper part of my body or my lower part of my back. So I've been happening to just take my time when I'm trying to clean my ears. It's just different because you can't feel with the neuropathy. So it's just really, really crazy. It just feels so different, you know. But I've been using my powder and glutamine, and I put a spoon of that once a week. I don't use it every day. I just use it once a week, and that helps out a lot too. But I'm still going to my part-time job in the evenings, Monday through Friday, and I that's my little form of exercise. I'm currently working the gates instead of working the flights. I'm working the gates, checking in drivers. So it's cool, nice little exercise for me to move around, get some circulation going on. Because I haven't been walking. I was walking and I had to stop walking because I didn't want to fall and I couldn't get anyone to walk with me. So I look forward to getting back to walking on a daily basis once the toenail has come back. And so my toenail will be back in place within the next 2 to 3 weeks. They said it take about 2 to 4 weeks um, for that to heal. So what I have to do, soak my toe twice a day, but I take baths twice a day. So I soak it in the morning when I'm in the bath and in the evening, and then I have to put neosporin on top. And then while I'm in the house, I leave the toe uncovered. And when I'm outside of the house or going somewhere, I wrap it up with the Band-Aid and put the neosporin on top of the toe. So, and then I wear a medical shoe because I am not able to wear any regular shoes. Just imagine wearing a regular shoe without a toenail. It was so discomforting. I know I could just talk about stuff like it's nothing, but I know to you all who are not probably in the medical field, it's probably like, oh my God, devastating. But to me, um, it's something that I've seen and I had to go through. So I'm good with speaking and sharing information about it. So anyway, I wear a medical shoe and I'm wearing a men's medical shoe because the women's medical shoe is too small. And I'm pretty sure the medical shoe is probably from a foreign country. It's probably why it's so small because I'm wearing a medium in men and that's fitting me perfectly. So um, other than that, that is it. I will be back on here tomorrow to share with you all when I um, either get to the hospital for my surgical removal of my port or after, depending on how I feel. I'm going to give you an update. If you don't hear from me, um, I don't feel good or something is wrong. But other than that, please remember to go on to my website, lrgsparadiseofstylesliaxjewels.org, and support me and Leah handmade jewelry, custom made jewelry. She specializes in beaded, and if you don't see anything you like, send us a picture. We'll check with our vendors. And we're no longer working with vendors in China. We're only working with our vendors here in the USA due to the new tariffs. Other than that, that's all I have to say. We have free shipping if you use the code Shamrock until March 18th, 11:59 p.m. Central Standard Time. And that is it. Actually, I told you wrong. Shamrock is for 35% off. Bye.